This is a WDIO News special report.
I'll turn the conference over to Michael Schammer. You may begin.
Thank you, operator, and thank you to everyone for joining us for the COVID-19 media call for August 21st with a special focus on K-12 issues. We'll start today's call with a quick situation report from MDH Infectious Disease Director Chris Erzman. We'll then hear some additional updates from Susan Clammer, the MDH Senior Epidemiologist who has been our point person on K-12 issues. Clammer is K-L-A-M-M-E-R. We'll also hear from Minnesota Department of Education Deputy Commissioner Heather Mueller, M-U-E-L-L-E-R. After these updates, we will open it up for questions from reporters on the line. I'll mention briefly, Commissioner Malcolm is obviously not on today's call, so we'd invite reporters to follow up with our office after the call if you happen to have questions that are outside that K-12 area of focus for Chris, Susan, and Heather today. With that, I'll now turn it over to Chris Erzman.
Thank you, Mike. I'll start with a global update. As of this morning, we are at 22.7 million cases globally with 794,000 deaths. The United States was at 5.5 million cases and 174,000 deaths. In Minnesota, we are now at 68,133 cases, up 835 from yesterday. The median age of our cases is 36 years old. Our new total for deaths is 1,753. We added 8 deaths yesterday. 4 of these deaths occurred in residents of long-term care facilities, 2 were in Hennepin County, 2 were in Ramsey County, 2 in Scott County, and 1 each in Nicollet and Dakota counties. The total includes 3 individuals in their 80s, 3 in their 70s, 1 in their 60s, and 1 in their 40s. There are 296 patients currently hospitalized and 136 in intensive care. We made a few updates to our online data yesterday, and I wanted to flag and go over some of that today. The age categories for our daily and weekly updates changed and have been updated to 5-year increments starting at age 0 and going all the way up to 100 plus years. Previously, the age increments had been 0 to 5 years, 6 to 19 years, and then 10-year increments starting at 20. So this provides a bit more resolution on what's happening within specific age groups. We did this to more accurately represent how COVID-19 is impacting Minnesotans of all ages. With regard to race ethnicity data, we have been reporting out this data daily on our website for some time. This data had been broken down into a race category and an ethnicity category, but as of yesterday, we are incorporating ethnicity into the race categories so that it is not shown separately. This change helps us align with how other data on race and ethnicity are being presented, including national data from CDC and other data we're sharing at the state level. For example, we have been reporting age-adjusted rates by race and ethnicity using these categories in our weekly report. Additionally, we have been hearing from communities that this change would align with how they prefer to report race and ethnicity information. The way we present data is meant to be as inclusive as possible of Minnesota's racially diverse state. Having data that is inclusive and accurately represents our diverse communities helps us better understand how COVID-19 is impacting Black, Hispanic, American Indian, and Asian community members. This change to the categories does not change what we have been seeing for disparities in Minnesota. We know that communities of color and American Indian communities are disproportionately impacted by COVID-19. We are working closely with communities to provide education, testing, and other resources to address COVID-19. A few things we've been doing include partnering with communities to provide safe and free on-site COVID-19 testing in areas with outbreaks, increasing cases, or other barriers to access existing testing sites. Contracting with diverse media and nonprofit organizations led by communities of color or American Indians for COVID-19 prevention, awareness, and outreach. working on strategies and additional resources to ensure communities of color and American Indians are supported throughout the process, from the testing site to case and contact interviews to isolation and quarantine and more. All of this is in partnership with community leaders and voices. Finally, we had an update related to likely exposure. This is how we are describing data related to how people may have been exposed. When we interview a case, we ask questions about where they were likely exposed. It's possible there could be more than one location or situation, so we have to try to determine the most likely place. We have a graph on our website titled Likely Exposure, where we report out the most likely place a case was exposed. The likely routes of transmission have changed as the pandemic has evolved. For example, early on, we saw more cases from travel and from workplace settings, but recently we have been seeing more outbreaks in settings like bars, restaurants, and other recreational activities. So those types of outbreaks have become more likely routes of transmission for the virus. We use a hierarchy for selecting the most likely exposure, and because of these shifts, we have made some changes to the hierarchy and are now placing more weight on exposures in a setting with a confirmed outbreak or an exposure to a confirmed case in a household. For example, if a case tells us that they were at a setting with a confirmed outbreak and that they are a healthcare worker but have not been in contact with any known cases at work, we would say that their most likely exposure was the confirmed outbreak, not a healthcare exposure. The order of the categories is now listed out on the website if you are interested in diving into this a bit more. I also want to give you an update that we had a successful community testing event yesterday in Glen Cove. We had broad community participation with a total of 791 people tested. On a separate note, we now have 15 confirmed cases of COVID-19 among Minnesotans who had been to Sturgis earlier this month, with one individual who was hospitalized. We know that there were many more people from Minnesota who attended the event and expect to see additional cases in the coming days. We also know that there were plenty of high-risk settings that could lead to COVID spread. So we want to reiterate our recommendation that if you did go to Sturgis, it's best to self-quarantine for 14 days upon return. Also, if you are feeling ill after returning from the event, please get tested and self-isolate while you wait for the test results. And then switching gears completely to the topic that more is in line with our K-12 focus today, I'd like to talk about school immunizations. Even with school looking different this year, we do want to remind parents that making sure their child is up to date on their immunizations is still a top priority. Things may change throughout the year with in-person learning, so now is the time to make sure your child is protected. Whether schools are doing in-person, hybrid, or distance learning, they are still being asked to enforce the school immunization law. So this means collecting documentation about required vaccines or legal exemption. If you are following the recommended immunization schedule, your child will be ready for school. We know pediatric immunization has decreased during COVID-19. We started to see a drop in March, and while levels are starting to come back up, they are not rebounding as fast for school-age kids and adolescents. We've seen decreases in doses given in these age groups of just over 30%, comparing 2020 to 2019. We are monitoring this closely and working with providers, school nurses, and other partners to help children get in for their immunizations. For parents, now is an important time to check with your child's health care provider to see what vaccines they need. Delaying or missing immunizations could put your child, your family, and your community at risk for serious diseases like whooping cough, chickenpox, or measles. Call your clinic to ask what vaccines your child needs and set up an appointment. Don't be afraid to ask questions about the steps the clinic is taking to protect patients and staff from COVID-19. And be prepared to do things like wear a mask to the appointment. Parents are doing everything they can to keep their children healthy right now. We do not have a vaccine for COVID-19 yet, but keeping your child up to date on other recommended immunizations is one way you can help protect them and your community. And don't forget, this includes getting a flu shot for your child and your whole family this fall. And with that, I'll turn it over to Susan Clammer.
Great, thank you so much, Chris. And I just want to touch on our previous guidance that we discussed, sort of in the vein of returning college students and the idea of laying low before you go back to campus, and really applying that as we think about a return to our K-12 schools in the next few weeks. So in other words, as we get within that window of 2 weeks before the start of school, we're really asking that you avoid settings with high risk of transmission. It's a good way to reduce your risk of picking up COVID and introducing it to your school, which, as we've seen, can be a real problem once school starts. We've seen national examples such as in Georgia, where hundreds of school staff either tested positive or had exposures to confirmed cases of COVID and were not able to participate in some back-to-school prep activities. This is the exact sort of situation that we want to avoid having spill over into our classrooms here in Minnesota, especially as we think about our districts who have teachers and students coming back for in-person learning. So with that in mind, we want to offer words of caution for everyone in the school community. School, and particularly in-person schooling, is a high priority, but not at the expense of safety for our school staff and students. So to make it possible for schools to successfully open for students learning in person and to stay open, it's going to be critically important that all members of the school community work together to follow public health guidance. That means, especially in this back-to-school time, when we're all eager to prepare and be out connecting with others in our school community, that we need to be mindful about staying home when sick, about seeking testing if you do have symptoms of COVID or if you've had close contact with a confirmed case, and to stay home and away from school prep and other activities while you're waiting for those test results. And of course, that also includes following the other practices we know help stop the spread of illness in any activities you do participate in. So using things like social distancing, masking, and good hand hygiene to prevent that spread. The more thoughtful we are about following this guidance that reduces the spread of illness, the more we can reduce community spread as we start school, and the better off we'll all be to both open our schools and to be able to keep them open. And so with that, I'm going to turn it over to our Deputy Commissioner, Heather Mueller, to talk about a few other topics related to K-12.
Thank you, Susan. Good afternoon, everyone. This is Heather Mueller, Deputy Commissioner with the Minnesota Department of Education. And we're just about 2 weeks away from the first day of school for most of our schools here in Minnesota. And it goes without saying that this school year is going to look different than we have experienced ever before. It's possible that our school communities will experience learning, hybrid learning, and distance learning throughout the course of the entire year. And after months of preparation, I believe our schools are ready. I believe our staff are ready. With all of the change we know this school year will bring, one thing is the same as every other year. Our students are going back to learning in just a couple of short weeks. And that means that it's important for our families and ourselves to start preparing, just like they always do as we approach the end of August. Now is the time for students to start rebuilding their routines, getting to bed early when possible, waking up early when possible, and really get into that, what that normal routine looks like for a school year, even though the school year isn't going to feel normal. It's time to make sure that students have the supplies that they need. Now, it might look a little bit different. They may be doing distance learning, and those supplies might look different. And also being thoughtful about what that looks like in a hybrid model and in an in-person model, but really having the opportunity to partner with your school district or with your charter school to determine what your student is going to need in order to help them be successful in this current safe learning model. It's also the opportunity for us to remind our children about the importance of good hand washing and hygiene. As students prepare to go back into the classroom, they should get into the habit of wearing their mask, build that routine into your time. And as adults, we have the opportunity to show them good examples of what masking up looks like for ourselves. Since the start of the pandemic, we've been talking about the importance of families having a plan in place should a family member get sick. And now is a great time to revisit those plans and make sure that everything is up to date for the school year and that we have the most up-to-date information for you and for your family within our school. Speaking of plans, by now, many school districts and charter schools have determined their learning model for the start of this coming school year, and those plans are being posted to our website, and if they aren't already, they are coming. I encourage families to carefully review your school's plan and reach out to your school district and your school if you have questions or concerns. Whether your student is starting the school year with some form of in-person learning, whether they're hybrid learning or if they're distance learning, take the time to talk to your student about what they're going to expect when the school year starts and how some expectations about what they are going to need to do at school is going to look different. Our school communities have worked hard to develop these plans, and it is important to recognize that each one of us plays a part in making sure the school year goes according to plan to the extent possible. We have seen examples around the country of what happens when schools struggle. I know Minnesota can do better than that, but in order to do better, we must reinforce the importance of these safety measures and the mitigation strategies for our students, for our staff. We are ready in Minnesota to ensure that each school is starting out the year in the safest way possible and has the support that they need to keep their students and their staff healthy and safe throughout the year. And with that, I will pass it back to Michael. Thank you.
Thank you, Heather. Operator, we are ready to take questions.
At this time, I would like to remind everyone, in order to ask a question, press star and the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. Again, that is star and the number 1. And we do have a question from Jennifer Austin.
Hi, hopefully you can hear me. I'm not quite sure how to unmute my line. I'm wondering if you could clarify what the guidelines are for teachers or staff with health conditions who don't want to be in the physical school building. Is a district required to let them work from home? And then a secondary component of that question, what about teachers or staff without a health condition who say that they just don't feel safe? In that situation, is the district required to let them work from home?
And Heather, I'll ask you to take that one.
Sure. Thank you. I appreciate the question. So the executive order language stipulates, to the extent possible, staff members who are identified as at risk, and those would be either people who are at risk themselves or people who are caring for family members or are caring for people in general who are at risk, should have the opportunity, to the extent possible, to request to work from home. We also have within that language the thought that you need to be working also with your human resources office to talk about what the extent possible means and what that means for you and your family. For the second part of your question, when you talk specifically about teachers who do not fall into the at-risk category, that is also something that they would work with their Office of Human Resources on.
So essentially, is it up to each district?
It is up to each district to work through that with their and use their bargaining agreements and their contracts, as well as have those conversations and then with an understanding with their union representatives and with their staff.
Thank you.
And your next question comes from Bill Werner.
Hi. Thank you for taking the question. I think this one is probably for Chris Erzman, and it's along the line of the outbreak that we saw at St. Olaf College. Are you keeping an eye on, or are you hearing of any other outbreaks at any other institutions around Minnesota?
Thank you, Bill. At this point, no, we're not. We have not heard of any other institutions of higher education that are experiencing outbreaks. We did hear about the St. Olaf outbreak, and certainly we're concerned about what is happening there. We have been in contact with St. Olaf. They have been part of the consortium of colleges and universities that we've been working with for quite some time to put guidance together. So yes, we've been in contact with them, but we have not been aware of any other schools that have had this similar situation.
May I just ask quickly a related question, because I know that you folks are in pretty regular communication with school districts, K-12 school districts around Minnesota, as we progress into the school year. Are you doing similar kind of calls with higher education institutions, either public and or private, around Minnesota?
Yes, absolutely. We have a team that is very similar to the K-12 team, and so they have been doing outreach and working with our institutions of higher education throughout the duration of the pandemic, and more recently with more, heightened conversation and guidance as we anticipate the start of the school year.
Thank you very much. Appreciate it.
Your next question comes from Emily Havoc.
Hi, this question would be for Chris as well. I actually have a question about the list of restaurants and establishments that have had COVID outbreaks. I know that that list that's been kind of publicized the last couple of days includes outbreaks from a wide period of time. Do you have numbers on how many of those are current? And also, if somebody sees these restaurants on a list, I guess what would you advise? I had some people reaching out to me saying, I was at this restaurant recently. Should I call them? Should I call the health department? So what's your advice for people who go to a restaurant and then, hear that there may be some transmission that's happened there?
Thank you for the question. A couple of things. One of the reasons that we think it's important to make information about these establishments public is because in many cases, the type of interactions that occurred, it's not always possible to identify particular individuals who might have been exposed. So certainly if you, were present at some of these places and you recognize that the social distancing and masking and some of the other guidance that we provide was not being followed and you now have symptoms, definitely you should be tested. Or if you're concerned, you certainly, could reach out to your healthcare provider to see if you could be tested. But the reason that we do make this public is because we aren't able to notify everyone individually. And so that sort of serves that purpose.
And then just to follow up, if a restaurant is, in this category of having a certain number of cases, I think it's 7 cases where the person said that was the only restaurant they went to, that qualifies it as basically being considered an outbreak or that transmission actually occurred at the restaurant. What does that necessarily mean that the restaurant was doing anything wrong? It certainly could be that they were following all the guidelines and just had a stroke of bad luck in that sense, correct?
Yes, I think that the point of making this information known is not necessarily to vilify the establishment, but to make sure that people are aware. Certainly, choices of patrons can make a difference in terms of the potential for transmission. So in other words, the restaurant, their servers could be masked. They could, be doing everything they can to promote social distancing, and you may have a situation in which patrons are making choices that will make transmission more likely. So that certainly is possible, but we also are aware of situations in which, in doing the interviews, we learned that there really are problems with how the restaurant is not following guidelines or not tracking with the executive orders. And so in those cases, we do, ask our environmental staff to go out and visit with the restaurant, talk to them about the guidance, and offer, help and suggestions for ways that they could be more successful in following our guidance.
Thank you, Chris. And then just to loop back on, is it possible to get any more specific data about when those outbreaks occurred and which ones may still be active?
Yes, we can get that to you, Emily. So we can do that in follow-up.
Thank you.
Yep.
And your next question comes from Peter Cox.
Yeah, first I'm curious about, we've seen numbers rising in both LeSueur and Waseca counties, and I'm wondering if that's connected to either any companies in those towns or in those counties or something else. And then secondly, I'm wondering if MDH has any recommendations for colleges and universities for kind of a a threshold at which you start recommending moving online or reducing in-person classes?
Certainly. I'll start with the college recommendations first. Yes, as you heard, we do have a team that's been working with our Office of Higher Education here in the state, as well as with colleges and universities across Minnesota. And part of the information that we have provided to them includes a scale, if you will, of, when you're seeing certain things on your campus or in your population, these are the actions you should take. And it does go all the way to saying, at a certain point, this is the time to consider going to full distance learning. So we are working with that, and we're making that available to our partners in higher education. And as for LeSueur and Waseca, I do believe that there have been some workplace transmission going on in those two settings, and I will try and pull that up and then mention it after the next question, if that's okay.
Yeah, that's great. Thank you.
And your next question comes from Jennifer Morel.
Hello? Jennifer may not.
Can you repeat the last name?
Morel.
Oh, okay. I'm sorry. I just didn't hear it right. It's Jennifer Merrill over at WCCO. Thanks for taking my question. I'm just wondering, going back to St. Olaf, I'm wondering, you said you were concerned about this. Can you talk about the level of concern when you see something like this at the beginning of a year? And what is the message to relay to schools, to students about this seriousness and severity of something like this?
Well, first of all, I think what's disconcerting is knowing the energy and the effort that both staff at the Department of Health, as well as the Office of Higher Education, as well as staff across the state at these institutions have put into planning for a safe learning environment for our college students, so that they have the opportunity to be on campus and to learn in the way that is most satisfying for them, as well as having the opportunity for some interactions socially. And so it's really disappointing to see this kind of behavior before or even as classes are just beginning to start. So not even giving the opportunity for all of the work that's been done to start. And I'll acknowledge I'm a St. Olaf graduate, so I'm an alum of St. Olaf, and so I was particularly disappointed because I know what a great school it is. And so I hope that for these students that this is an opportunity to learn about the importance of how you make a difference in your community, not only by what you do with your career, but by the choices that you make, even in the little things. And so I'm trusting that as a proud Ole that they will turn out to be great alum, and they will really learn from this experience. But I think that the concern is that we really haven't had the opportunity to have students, really do classroom learning and, do all of those things. So that's why it's concerning. It's both the number, it's the disregard for, measures that will protect themselves and their friends and colleagues. And then it's also because of the work that I know that has gone into making this fall semester a positive one for as many of the students across the state as possible. And so it's disappointing when this happens so soon.
Is this, if I can just ask a follow-up, is this kind of one of the concerns that we're looking at with this age of student, that they could make these choices to do something like this not just at St. Olaf, but other places and continue the spread?
Absolutely. And when we look at our case numbers, I mean, the number of cases that we're seeing in our 15 to 19 and 20 to 29-year-old age group, that is where we're seeing the most transmission now. And so it is concerning. And certainly, you know, St. Olaf is getting attention now because it's the first place, but that is certainly not unique to college students just at that institution. In fact, you know, we're seeing it in that age group across the state, and I expect that we could see it many more places. But our hope is that people learn from this. We were hoping that people would learn from what was happening in North Carolina. But, you know, I think it's a hard age group to really get that message through to.
Thank you.
And your next question comes from Chris Snowbeck.
Oh, hi. I wondered if you can go through the timeline of the Sturgis exposures. I'm sort of curious why. I mean, this is 15 all at once, and being reported out. And I think we haven't had any reports before this in Minnesota. Is that right? And I don't know if you have any thoughts about why the volume all of a sudden and whether you expect more.
Certainly. Thanks, Chris. And let me, before I answer your question, I want to get back to the Le Sueur-Waseca question that Peter Cox raised. And so the transmission that we're seeing, and thanks to the public health director there who quickly shot me an email, we're seeing transmission due to community spread. Individuals work in a common industry, but the transmission is not happening because of spread in the workplace, but rather community transmission. And then onto your question, Chris, we had one case yesterday. We've added 14 today. I think that, you know, we're expecting that we're going to see many more cases associated with Sturgis. Thousands of people attended that event. And so, you know, it's very likely that we will see more transmission. And obviously, you know, it takes a while for people to, you know, develop symptoms and to get tested and for us to get those results. So yes, we do anticipate that this will not be the only cases that we see.
And just as a follow-up, so these are 15 Minnesotans who went to the event, and it looks like they were exposed there. And then one of those 15 is currently in the hospital here in Minnesota. Is that right?
Yes, that's correct. So these are individuals who, you know, are cases who indicated that they attended events related to Sturgis.
Okay.
And one person in the hospital.
So one hospital. Just the last thing to sneak in. The South Dakota folks have indicated they put notices out about exposures, one involving an employee at a tattoo parlor, one with a saloon patron. I don't know if you know if any of these 15 is connected with kind of either of those exposures that South Dakota has publicized.
You know, I do have a little bit more information about our Sturgis cases, and we know that one person worked in a temporary bar situation, but did not necessarily have, I don't have data on those specific exposures, but Chris, I will check on that and get back to you. You said tattoo parlor and
a saloon, yeah.
Saloon. Okay. All right.
Okay, thanks.
And your next question comes from Jill Burkham.
Hi, Chris Novak kind of asked my question, but I'll follow up a little bit. Can you tell us anything else about the cases linked to Sturgis? For example, did they have something in common, such as eating at the same restaurant, going to the same concert, or being at the same campground? I think there's a lot of interest in this. I'm just wondering if you can tell us anything more.
Yep, and I'm just trying to pull up the social outbreak summary here quickly so that I can get that information for you. So we had 15 total cases that were associated with attending events. One was a volunteer or an employee. 14 were attendees. One case was hospitalized, and the cases report multiple campgrounds and bars in Sturgis. One case was a temporary employee of a Sturgis bar that hosted events for the rally. So at this point, with the cases that have come in, we don't have anything tied to Chris's questions about tattoo or salon. And it sounds like these individuals were attending multiple different, events, bars while they were there. And then, I'll leave it at that. And then I did get some information here on restaurants for Emily. And so, we'll get that to you. We have only 5 of the 29 establishments that we're actively monitoring, although we continue to keep an eye on case counts for a month after each, restaurant or establishment is, identified. And so we started working on this as of June 1st when restaurants and bars reopened, and our first outbreaks were around the weekend of June 12th. So I hope that helps with your questions, Emily, and if not, we can connect via email.
Thank you.
And your final question comes from Steve Kornowski.
Yeah, I think we got most of that answered. My interest was on Sturgis, but yeah, just any other details that you have there that you can tell us.
That was the extent of what we have on Sturgis, but as I said, these are just the very first days of positive case reports that we're receiving. So as we get more information, we may be able to comment more about what's happening. But at this point, I've given you what we have related to Sturgis.
Operator, we do have time for one more question, I believe.
And again, if you would like to ask a question, press star and the number 1. And we do have a question from Jennifer Austin.
Yeah, hi. Thanks for taking my question again. For Deputy Commissioner Mueller, if I could have your reaction to, in the past few days, we've seen a number of school districts change from their decision to start the school year with hybrid learning and now announcing that they're going to scale back to full distance learning. I'd like your reaction to that. And then I'm also wondering if you expect more districts in the days to come, in the weeks here, a couple weeks leading up to the start of school, whether you anticipate more making a similar decision and a scaling back of their plans to start the school year.
Well, thank you very much for that question. I think that the answer really needs, because there's a lot of variables that are really taken into consideration as school districts are making these decisions. One aspect is the county health data that continues to be updated weekly that gives us information about where their county is at. And the other side of that is really also being thoughtful about what they have in place to be able to support the safety, health, and wellness of their students and staff. The space that they're able to provide in the distancing that's needed, continuing to ensure that they have the staff who's available to be able to provide the support. It's a lot of logistical pieces. And I think the other piece of that is they're really working with their communities and to get a sense of where their community is, where their interests lie in what model really fits best. Moving to a more restrictive model is never a bad choice when given the opportunity to be really thoughtful or to maintain that model. And so there's a lot of conversations that go into becoming less restrictive, but the thoughtfulness around going also more restrictive is something that we know a number of our school districts and charter school leaders are really being thoughtful about and partnering with their community and families in that.
In a follow-up, if I could, I believe right now the updated guidance from MDH has just about, if not all, every county in the state in some form of in-person learning, whether that's hybrid or full in-person. There's not, the case rate isn't to where any district or county in the state falls under required distance learning. Is there any point where the state would step in and require districts to do hybrid or in-person learning, some form of hybrid or in-person learning, or is this essentially up to each district no matter what that case rate ends up being?
Well, I think that it's a couple of things. One, as you heard the governor and the lieutenant governor, when we announced this plan originally, it really is looking at helping to provide concrete data and supporting local control. And, there is also the other variables, in addition to looking at the logistics and the operational abilities to have school, it's also recognizing where your school community is at and where the community is at large. And to continue to really put first and foremost at the center the health, the safety, and the wellness of our students and our staff and their families, that may be a decision that they're continuing to make. And I think that if we moved down that path, I think that would have to be a conversation down the road. What we're really thinking about now is how is it that we open up school and opportunity, maintain the health, safety, and wellness, and think about the academic integrity for our students.
Thank you.
Thank you.
Thank you, everyone. That is all the time we have for the call today. If you had a question we were not able to get to, please feel free to reach out to the MDH or MDE communications offices. Have a good day, and we will be back with you again on Monday.
This has been a WDIO News Special Report.